First, let me now take the opportunity to introduce my colleagues at the at the DPP, that help with the cooperative study with USGS and also our participants in our national work group. And that's Rhonda Manning, she's our section chief there. Paul Curry, he's new on board, but he also is a water program specialist. And Bob Titler, who has been involved with the project since phase 1, and he's an environmental chemist with the department. So again, like I said, we're all active members of this EPA Region 3 Pharmaceutical Return Work Group. So along with our duties for phase 1 and phase 2 of the emerging contaminant study, we also look to see what proactive approaches can we take to removing these pharmaceuticals from our waters to begin with. So our goal is, again, to take a proactive approach to prevent pollution. We know we are detecting these pharmaceuticals, antibiotics, hormones in our waters, and we are seeing the effects in our aquatic environment. So what are we going to do to address the situation now, and what can we readily change? So we have to start thinking about how do these pharmaceuticals get into our waters in the first place? Well, there's two avenues. The first would be purposeful discharge, or that would be equivalent to flushing our pharmaceuticals or throwing them into the trash. And the second way would be inadvertent discharge or excretion into our sanitary sewers. We tend to believe that excretion is a larger contributor since many of our pharmaceuticals do not metabolize fully upon ingestion. Though a great number of pharmacies, hospices, assisted care facilities, hospitals continue to utilize flushing as a means to dispose of unwanted pharmaceuticals. As Kent mentioned, it's estimated that they discard 250 million pounds of pharmaceuticals each year. So a little bit about what is the problem. You can see these statistics here. It's staggering. Nearly 50% use at least one prescription drug daily. The U.S. prescription drug sales were up 8.3% to $275 billion in 2006. It's staggering the amount of pharmaceuticals we use in this country. A little bit more. Almost 800 million prescriptions were dispensed in 2007. That's a 60% increase in 10 years from 1997. And 40% of the antibiotics manufactured are actually fed to our livestock. So it's not just human consumption, but it's also agricultural consumption as well. So with all this ingestion of pharmaceuticals, still there is no systematic method for consumers to dispose of their pharmaceuticals. That is, unless you consider down the drain method. So some of the concerns, and Ken spoke about this in depth, the concerns to our environment. As he said, there's no research to indicate that these minute concentrations, these parts per billion and parts per trillion, are harmful to human health at this point, though we have seen the effects in our aquatic life. And again, Kent mentioned the intersex conditions in our Potomac watershed. So of particular concern are the antibiotics and the estrogens. Again, antibiotic resistance is a concern, as well as those endocrine disruptors. Because the laboratory technology has become so sensitive and that we can see these compounds at parts per billion, parts per trillion levels, we are detecting these compounds wherever we look, particularly downstream of wastewater treatment plants. And many of these pharmaceuticals are intended to be effective at smaller doses. And some of the pharmaceuticals can be significantly transformed by chlorination at wastewater and drinking water treatment plants. And in turn, the disinfection byproducts can often be more toxic and persistent than the original compounds. And unfortunately, we're left with more questions than answers about the effects of these pharmaceuticals on our aquatic species and human health. So why can't we just take the pharmaceuticals out of Pennsylvania waters? Well, unfortunately, our treatment plants were not designed to remove these emerging contaminants. Although there are several promising technologies that are out there, they all have their pros and cons, as Ken mentioned. There's not one single treatment technology that will remove all of the compounds that are out there. So removal is dependent upon the concentration and the structure of the compound. So here's where I start to think, why not we just focus on removing the source of contamination rather than spend billions of dollars to treat it? So pollution prevention is definitely key here. federal government done to acknowledge the issue? There have been 2 federal publications on the proper disposal of prescription drugs. One came from the White House Office of Drug Control Policy, and they were published in February of 2007, the federal guidelines for the proper disposal of prescription drugs. And then the Smart RX disposal was published in March of 2008. Not talking about them a little more in detail. The federal guidelines suggest that we take our unwanted meds out of the containers and place the containers in the trash. We mix the prescription medication or prescription drugs with an undesirable substance such as kitty litter or coffee grounds and put them in impermeable, nondescript containers and place them in the trash, where they'll go to hopefully a captain-lined landfill. There are 13 pharmaceuticals that the guidelines list that should be flushed, and that's because they are controlled substances and they still are very concerned about the issue of diversion. And then they do indicate and recommend to use community return programs wherever they're available, although they're available few and far between. The Smart RX disposal campaign is a partnership among the U.S. Fish and Wildlife Association, the APA, and Pharma. They also have guidelines that are similar to the federal guidelines where they indicate and encourage people not to flush. And they also stress public education through their website, flyers, fact sheets, and bookmarks that they employ pharmacies to hand out. So the Environmental Protection Agency has also published a Federal Register notice for an information collection request to perform a detailed study of unused pharmaceutical disposal methods by hospitals, long-term care facilities, hospices, and veterinary hospitals. So this collection study or collection request should allow us to see how much is actually being flushed out there by these entities. Another local initiative occurred in New York where the Governor Patterson of New York and the Commissioner of the New York State Department of Environmental Conservation, in coordination with their state education department, launched a Do Not Flush Your Drugs campaign last month to help raise public awareness and provide information about how to dispose of medicines properly and to help prevent water quality issues in the future. Some more Pennsylvania efforts through our participation in our EPA Pharmaceutical Return Work Group and a small grant from EPA to the Women's Health and Environmental Network. We assisted in the development of a local pilot stewardship program at an inner-city Philadelphia Senior Community Center to help them utilize a reverse distributor to dispose of their medications rather than putting them in the trash. And the DEP Bureau of Waste is really leading the charge at the DEP in conjunction with their household hazardous waste program. They're now having one-day collection events to collect pharmaceuticals. They're not at the same day, they're separate days. They've had one event so far and 2 more should be this month. The first event was in Elk County. 75 people participated. 258 pounds of pharmaceuticals, of uncontrolled pharmaceuticals, were removed from the waste stream, and a 5-gallon bucket full of controlled substances were collected. They reimburse the county recycling coordinators 50% of their costs to have these one-day collection events, but the requirements to hold an event are hefty. We require law enforcement. That is because DEA knows that if you're going to have a collection event, most likely controlled substances are going to come, and if that's the case, then law enforcement must be present to take away those controlled substances. In order to do that, we need a pharmacist there also to be able to sort between the controlled and non-controlled substances. They require a hazardous waste hauler to remove the uncontrolled substances that will then go to a hazardous waste incinerator. We have no hazardous waste incinerators in Pennsylvania, so there's that. They had to take them to Ohio. Also requires a waste manifestation so that we know that the waste is getting from point A to point B and is being, in fact, destroyed the way that it was supposed to. And it also requires an approval from the Department of Health to collect the medications. So a lot of requirements in these one-day collection events.